Well, I think we have a majority of folks that are going to be here today. I am going to just kick things off. Program manager for the HIV Resources Admin Unit, and quite a lot of my job duties revolve around clinical quality management. I'm going to kick it over to Jennifer LeBlanc, who is our clinical quality management coordinator, and she will facilitate the meeting. Thanks. You're muted.
Muted. Thanks, Ken. Good morning, everyone, and thanks for joining us today. Today's agenda will include introductions, and it'll be followed up with a review of the clinical quality management plan, followed up with the quality improvement project worksheets. And to finish it off, we'll have a training around the national monitoring standards. So what I'd like to do is have everyone just one at a time come off mute, introduce yourself, tell us what agency you're with and what your role is. So whoever wants to jump on in, please do that.
Hi, everybody. I'm Emily Johnston with Integral Care's Care Program, and I'm the program manager here. And I'm here with Alita.
My name is Alita Allen, and I am a client of the Care Program.
Why doesn't whoever just introduced themselves pick someone to go next?
Okay. How about Emma?
Thanks, Emily. Hi, I'm Emma Sinnett. I'm Director of Grants Management at Vivint Health, and I'm participating because Aubrey is actually out. Unfortunately, she has COVID. It's still around, people. I'm gonna bump it over to Adam.
Hi, my name is Adam Carlson. I'm with Vivint Health, but I am stationed in Milwaukee. And I'm the Director of Quality Management. And I'm not sure who hasn't gone, I just hopped on. So.
It's a free-for-all. Only me and Emily have been introduced, and you.
Oh, great, okay. Then I'll go to Ken.
Since I've already introduced myself, I'm going to go ahead and call on Catherine Harrington. Dr. Harrington.
Hi, Ken. I'm Catherine Harrington. I am now the new provider at the AHF location here in Austin. Let's go with the square next to me, Michael Coran.
Well, now I know where I am on your computer. Hi, I'm Michael Coran. I'm with Collaborative Research. We're the consultants. We do the monitoring for Austin, and we also run the CQM meetings here. I'm going to pass it along to my colleagues, Derek Jackson.
Hello, my name is Derek Jackson, also with Collaborative Research, and I'll pass it to Thomas.
And Thomas Rodriguez-Schucker, also with Collaborative Research. And I will kick it to Christy.
My name is Christy Hanley. I am the program manager at Brazos Valley Council of Governments. We are the administrative agency for Part B, and I will pass it over to Stacy.
Stacy Martinez with Community Action, and I am the program coordinator. I will pass it to Todd.
I was on mute, pardon me, and I'm with Project Transitions, and I am the grant manager. Let's see, I need to look at view to see who hasn't gone yet. Let's see, how about Justin Farrell. Ha.
Good morning, everyone. Justin Farrell, Program Manager for the HIV Resources Administration Unit. And I'm not sure who went, but Kim or Raju.
Hello. Good morning, everyone. My name is Raju Kimire. I'm Research Analyst at HIV Resources Administration Unit. I jump over to Kim.
I think Kim said in the chat she's having some audio issues.
Okay. Then Danny.
Morning, Danny Steele, David Powell Clinic. Title here is Data Quality Management Specialist. I'll pass it over to Yahida.
Good morning, everyone. Yahaira Saldivar-Solis here, Grants Manager for HIV and Sexual Health Programs at Community Care. I'll pass it over to Brenna. As soon as she's taking a sip of coffee. Sorry, Brenna.
Hi, I'm Brenna Tucker, Compliance Specialist here at Community Care. We support the David Powell is one of our clinics, and that I'm usually involved with the monitoring process and providing mainly policy support, but at least that's my role when it comes to Ryan White. And I will pass it over to Chandrea.
Good morning. My name is Chandrea Haroon, Administrator for David Powell and the Sexual Health Team. And I will pass it over to, I guess, Sandra.
Hi, the last time it was to Sandra, so that was the hesitation. My name is Sandra Najuna. I'm the Quality Project Manager for AIDS Healthcare Foundation. It's great to hear from Dr. Harrington, our new doctor. We're new to the area. I will pass it on to Astrid, who is part of our team.
Hi, this is Astrid Edison with AHF, Contract Manager. And I will pass it over to Jahida.
I just went, but I think, Stacy, have you gone?
Yes, I've gone.
Oh, we might be done.
Yep, I think we're done.
What about Liz Gray?
Oh.
Hi, good morning. I'm Liz. I'm newly stepping into the role of Director of Operations at Ashwell, and Susie Vega will be taking my place as the Program Manager at Ashwell. I'm just here representing today because Sandra is also out of town with a personal matter.
All right, I think we've covered everybody, and so just really quickly, I want to jump back to the screen for the presentation today. So in the future, what we're going to do is you'll be receiving a SurveyMonkey survey from us to kind of identify who your agency's single point of contact is. And so what we'll be doing and what Jennifer will be asking of the sub-recipients is for the management team to identify one person who will be solely responsible for the CQM and quality improvement projects. Now, you may have as many people on your team that you would like to join, but we just need to identify one particular person who's always going to be that contact person for our QI. And then we'll kind of use this chart when we go forward for checking in. We'll make sure our sub-recipients are here. And you'll also see that I've also kind of listed out the funding. So one of the things that we want to make sure we do in our CQM plan is make sure we encompass all of our programs, whether that be Ryan White, general funds, HOPWA, or ending the HIV epidemic funding, right? So we want to make sure that we're covering all of those aspects when we get to clinical quality management. All right, Jennifer, I'll turn it back over to you, ma'am. Or Ken or Justin, if y'all have any updates from the recipient's office at this time.
Yeah, I have just a few updates. The Planning Council is going to be starting their priority setting and resource allocation process at the end of August. I believe they have 2 dates earmarked as of now. So that should be completed by the end of next month. They'll also be working on the needs assessment, which will be administered in the coming months. And the results of that needs assessment will be used to develop the integrated plan, which will also be in collaboration with Ending the HIV Epidemic Grant. Then finally, recently heard that Part B will possibly be moving to remove the 6-month recertification for the PCN that was released 2102. From my understanding, they will not be removing that for ADAP, but for the general Part B programs, they will be. And as a result, I think we're going to evaluate revising our eligibility process for the to remove the 6-month certification, just to streamline programs. That's all I have.
Thank you, Justin. It looks like there's a question from Emma. She was wondering if the dates published for those PC meetings, and could they work with could the PC work with the providers and the public to know about those meetings?
Yes, I will reach out to them. Not sure if they're published as of yet, but I'll definitely reach out to them and ensure that everyone's aware.
Thank you.
All right. Any other questions for the recipient's office? Oh, come on, computer. There we go. All right. The next big item is an update to our CQM plan. So I did send that out, and you probably did not have enough time to review that. But however, I just kind of wanted to go over that very quickly to give a kind of some insight on the quality improvement plan. So what we are asking is that, oops, stop sharing, let me try that again. Here we go. So everybody to kind of review this, there are some updates that you already see that are highlighted in there that we need to take a look at, an update from that. But it gives you a very generalized sense of what the clinical quality management plan is going to look like. So we've broken it down to a couple of different sections: introduction, quality statement, annual quality goals, quality infrastructure, evaluation, communication and dissemination, performance measurement, quality improvement, work plan, capacity building, and finally, the quality improvement worksheets. And I'm hoping that I've been working on these project worksheets for a while, trying to make sure that they are very streamlined and very easy to utilize. So for those of you who may be new to quality improvement and Plan, Do, Study, Act method, hopefully they are very easy to follow. At the next meeting, we will go over some more trainings on what is the Plan, Do, Study, Act, what are aim statements. So we'll kind of walk you through the process. But I would highly recommend to take a look at those worksheets now so you can familiarize yourself with those, and we'll see those in a bit. So very, very quickly, we're going to update some of the introduction to give more of the demographic update of the transitional grant area. And keep in mind that our clinical quality management plan is designed around policy clarification notice 1502. So making sure that we have the main components that 1502 from HRSA-HAB says that the clinical quality management program should include. So looking at infrastructure, performance measurement, and again, quality improvement. And so sometimes we'll use quality improvement and Pdsa interchangeably. They do the same thing. The Pdsa is just basically the bones of getting the quality improvement done. And so Pdsa, Plan, Do, Study, Act kind of moves you through a quality improvement process. And some of our annual goals, so goal 1, promote continuous quality improvement initiatives across the TGA. That will include all of our funding sources, so Ryan White, General Fund, HOPWA, and Ending the HIV Epidemic. So we are going to update some of the language to include Ending the HIV Epidemic. There might not be specific goals aligned directly to ending the HIV epidemic, but nonetheless, we will still working towards, viral suppression, which is a very, easy, low-hanging fruit that everybody can start with on their very first quality improvement if you're new. That can align itself to any of the funded projects that you were funded for, right? Because our ultimate goal for all of these projects are basically ending the HIV epidemic, right? Or getting everybody to viral suppression. Our second goal is improve the quality of core and support services, improve the performance measurement system to appropriately assess outcomes for people with HIV, and to ensure the comprehensive involvement of people with HIV in the quality improvement process, right? So not, we do this every single day working in the field, but we want our community members to also be engaged and understand the quality improvement projects. Also, they help us tell our community why we do so many surveys, why we ask so many questions about how services are going. So if we have community members disseminating the information as well, it really does help with our end and long-term goals. So when we start thinking about the quality infrastructure for the CQM program, again, HRSA does like to see some spelled out representation and what those specific goals and accomplishments or responsibilities may be for that particular person. At the end of the day, Justin is the person who all of this falls upon, right? We break it down and give everybody else some responsibilities, but at the end of the day, Justin's going to have to be the person who answers the HRSA to say, yeah, we're doing it, no, we're not doing it. So he has some very high level goals, which would be to endorse, champion, and promote our CQM program, provide leadership to our CQM program. He has the final approval of all of our CQM plans. He approves the quality improvement projects and our plan, do, study, activities that are involved in our quality improvement projects. He'll help to provide guidance for policies and procedures and compliance components for clinical quality improvement. He will review all the reports for CQM activities, and he'll report those to HRSA and HAB and our project officer. And he'll help coordinate and assist with training and technical assistance issues. Jennifer LeBlanc, who is our clinical quality management coordinator. She will be the chair that oversees the CQM committee. She will attend all CQM committee meetings as she can. She'll lead the CQM committee. She'll endorse, champion, and promote CQM program. She'll provide leadership, help approve CQM plans, conduct organizational assessments of subrecipients, and these organizational assessments are directly related to clinical quality management. So making sure that our subrecipients have the tools they need to be successful in quality improvement projects. She'll also help approve quality improvement in Pdsa activities, help track outcomes for clinical quality improvement activities and PDSAs, provide guidance for policies, procedures, and compliance, report to HRSA HAB as well, and coordinate all technical assistance and training. Next is our HRAU research analyst, Dr. Raju. He will help in assisting attend all meetings, provide statistical reports that consist of tracking clinical outcomes, collaborate with the recipient and the CQM consultant to track performance measures, provide training to subrecipients on CQM and QI reports in TCT. I don't know if that's true. We might have to update this. I don't know if anybody is an expert in TCT yet, or if TCT is even working correctly yet for anybody to get a report out of. So we might have to put update this one. And also help import current viral load CD4 or clinical measurements into whatever system that we're using for the health information systems. Next is our CQM consultant, and that's collaborative research. That's myself, Michael Coran, and Derek Jackson. We will attend meetings, we'll help coordinate and facilitate these meetings. We'll help draft and update the annual CQM plan, assist in organizational assessments of the subrecipients, develop quality improvement activities, help in tracking outcomes, help disseminate programmatic activities. Something I want to introduce to you today, and you may already be familiar with, is Basecamp. And I'm going to propose that with everybody's consent that we start using Basecamp as a place for us to be able to gather virtually, share documents, share meeting dates, be able to talk back and forth with our colleagues about quality improvement activities. And so we'll look at that in a little bit later. Provide leadership and support the CQM program, guidance and selection and implementation of QI projects, assist in the coordination of technical assistance, and post agendas, minutes, and resources. Our Part A consumers, they'll also be committee members. We'll ask them to attend CQM meetings regularly, provide guidance to the annual CQM plan, provide guidance to our TGA-wide quality improvement projects, participate in consumer satisfaction surveys, actively participate and collaborate with as a consumer of services, Disseminate CQM and QI activities into the community, and participate in any mandatory training for our CQM and QI. Our subrecipients, once we have a complete list of our SPOCs and our subrecipients, we will list each of you here. And again, we will only list the SPOC who's responsible for this, because HRSA will want to see who particularly from each agency is on our QM committee. And so we'll ask our subrecipients to attend meetings. And if you can't attend the meeting, send somebody, who can bring back the information to you. Also, by using Basecamp, we do record each of these meetings. I'll be able to post those meetings so you can either watch it or listen to it later if you were not able to make it, so that way you didn't miss anything. We'll also ask you to provide guidance on the annual CQM plan, participate in organizational assessments, help guide the TGA-wide QI projects, be accountable for entering current and consistent service data into whatever health information system you're utilizing or that the TGA will be utilizing. Conduct consumer satisfaction surveys, participate and collaborate with as subject matter experts for our CQM committee, be involved in the day-to-day activities related to QI projects within your own organizations, meet contract deliverables, develop and track quality improvement projects, disseminate QI activity to your agency staff, participate in trainings, and present your findings at the CQM committee once our cycle is completed. Again, we'll identify who exactly are their SPOCs for our other parts, B and C. And we'll ask other Ryan White parts to attend our meetings, collaborate with our program to align and leverage community-wide efforts, share resources, knowledge, and expertise in our CQM activities, and help, in Part B's instance, help request HIV surveillance data or any other type of data we may need from the state. Same for Part C and HOPWA. They will all share the same responsibilities in reporting back what's happening within their own prospective programs. And then what do we expect out of our community stakeholders? So we'll also expect someone from the Planning Council, whether that be a specific committee or just the Planning Council chair or vice chair in general, to participate in that. We will help us review and utilize data for Planning Council activities. That includes for their priority setting and resource allocations process, help identify areas for improvement in service delivery, provide periodical updates on service standard updates, review and utilize service data as reports, and use of quality management data in their decision-making processes. The AIDS education training will ask them to assist in targeted multidisciplinary education and training programs for healthcare providers and our quality improvement and CQM committee. And community members provide community input, attend meetings, participate in surveys as needed, and disseminate this information into our community. So it's kind of a broad, high-level look at what our dissemination process is and what our structure will look like. Next, we'll go into the evaluation section. This talks more about the quality improvement worksheet, and we'll look at that in a second, in our Plan, Do, Study, Act process. And then kind of a communication and dissemination table of how we plan to regularly communicate CQM activities. So how will we communicate our CQM plan? We'll ask all of our stakeholders at least annually to kind of discuss these. So we'll present the CQM plan at the CQM committee. We'll present it at the Planning Council. Hopefully we'll be able to publish this on the TGA's website or the Ryan White websites for our community to review. And then for all of ours, for the CQM committee, we'll also post this on Basecamp for us to look at as needed. Service standards, those are responsible stakeholders, at least annually update the service standard or as needed. And then we'll disseminate that in the CQM committee, Planning Council, and TGA's website. Service-specific outcomes, so we'll look at those quarterly, and those could be things of service utilization or any type of service delivery methods or models that we want to look at. Again, we'll look at that TGA wide at the CQM committee, publish that on the website, and also Basecamp for our subrecipients to utilize in their quality improvement projects. Annual site reviews, which is quality assurance and clinical quality management monitoring. And so again, as you know, this year we presented, collaborative research presented a trending document that kind of looked at a holistic approach of service delivery across multiple funding streams. And so we'll continue to do that at least annually, making that presentation to the CQM committee the Planning Council and also posting that for review by the public. Finally, monitoring service reports. This is for the HRSA project officer, and these are the reports that we give on a monthly basis, and it's quantitative and narrative reports to HRSA and HAB, and then CQM bulletins. Once we get rolling on the CQM project, we could create quarterly bulletins or monthly bulletins. So this may need to change depending on how quickly we get the hang of the CQM project, but just really updating our community on what the CQM committee is doing and how we're moving forward with some of our projects. Again, this entire plan is a living document, and at HRSA's recommendation, we should update this as needed, right? Do a full overhaul once a year to make sure that it's new and it addresses what we're doing. But as little things change throughout the year, it's okay to make updates to this as we go along, right? None of this is in stone. The next portion of the CQM plan is looking at performance measures. I need to work with the recipient's office and kind of updating what we call a performance measure portfolio. So I use some examples of some other jurisdictions we work with just to kind of put some pretty pictures in here to give us an idea of what does a performance portfolio look like. So as a recommendation from Policy Clarification Notice 1502, what we'll do is we'll look at the number of eligible clients in the jurisdiction and determine what percentage of people utilize a particular service. So HRSA says that if your entire population, less than 15% of your population use the service, we don't necessarily have to have a performance measure, right? If more than 15 but less than 50% utilize the service, then we need one performance measure. And if more than 50% utilize the service, we'll need two performance measures to track in our CQM program. That's outside of your quality improvement and Pdsa cycle. This will be system-wide. This was something that the recipient will do and will report back at the CQM committee as well as the Planning Council, right? So just looking at this, sorry, I put that big picture over top of it. But kind of looking at this, we'll see one we can see as outpatient ambulatory health services. For this particular jurisdiction, 1,587 clients were eligible for the service, 402 utilized it. So they had roughly a 25% utilization. So they required one performance measure, right? And for this particular jurisdiction, it was viral load suppression. They have a issue with data and data entry. And so this was a low-hanging fruit that we could increase pretty efficiently and pretty fast along a quality improvement project. Next, we'll also update the continuum of care definition in accordance with your jurisdiction to make sure we're following that. The ultimate goal is to be able to provide continuum of care dashboards for each of your funded service categories. This is what we want to work to. Whenever TCT starts working and we can see what kind of data we can get from that, I think this will help us tremendously in looking at viral load suppression and what services we can utilize as quality improvement projects, or even for your entire agency system-wide. Next is the quality improvement process. And again, we're going to be utilizing the Plan, Do, Study, Act version of the quality improvement project. Plan, develop an objective with questions and predictions. Do, carry out the plan on a small scale and document the process. Study and check. So basically, after you're finished doing the implementation, let's look at the data and let's see how that worked, and then act. Do we adopt that process continuously? Do we make a little tweak to it to make it better? And so that's the kind of the Pdsa process. It's fairly simple, and again, we're going to highly recommend to pick a very low-hanging fruit for your first one, and we'll work with you on that. Next, what I've done is created a work plan that's based around six different headings. And so what we'll look at in the work plan is a goal, the status of that goal, the action steps for completing that, the target date, who's responsible, and some resolution notes of what happened with that. I, for one, really like colors because it kind of helps me pinpoint where I might be behind or where I might need to give a little more attention to. So our very first goal is a biannual review and update of the TGA's quality management plan. How do we do that? The recipient and CQM consultant will present the draft. The committee will review it. The committee will present their finalized plan by August. And then we'll finalize, the recipient will finalize and endorse that plan to say, yep, that's what we're going to go with moving forward. The process is to have this completed and reviewed pending by August. August to finalize it, September to send it to her and say, this is our plan. Next couple of goals, I'm not going to read them all to you because I want to give you a little bit of chance to kind of go through it and understand it. But we'll jump down to the end. So what we would like to do once TCT starts working and we can identify some measures that we can grab out of the dashboards is to really look at your care continuum dashboard across your agency and ask our SPOCs to present that on a regular basis at each meeting. And that will kind of give you an outlook also on like where your viral load suppressions are looking like, where your retention and care is looking like on a monthly basis. And finally, some more future things. So we'll take some things from above that we do this year and we'll bring them down so that we're all the way out to August of 2023, just to give us kind of insight of where we're going, always trying to project at least a year in advance. Capacity building, again, that's looking at who our community partners are, how we're increasing our efficiencies across our quality improvement projects, and what types of instruments we're using to increase those efficiencies. So whether that be our AIDS education training centers or Basecamp, just to be able to talk, amongst ourselves and thinking of clinical quality management on a regular basis. All right, I'll pause there for a second because our next one's going to be looking at the worksheets. Any questions or thoughts so far about this? Does it seem to be fairly easy to track through and understandable? Okay, awesome. I see some head shaking. Good. All right. Perfect. All right. So let's go right on into our quality improvement worksheets. So I set this up so that we can track things on a regular basis and make the clinical quality improvement projects very streamlined and I think easy to track. So here, again, our primary is going to be the SPOC. This is an opportunity for us, for you to tell us who else is going to be involved in your projects. That way we can make sure they're on the email list. That way we can also include them in the Basecamp because there may be some documents in there and some discussions they may want to have amongst other colleagues in the jurisdiction. We'll ask you to title your project start and end dates and your project location. So some of you may have multiple offices. So we're leaving that up. It can be one office. We're not asking you to run 7 projects across 7 offices, just one project across wherever you may be doing that. It could be a triage nurse. It could be a case management, wherever you pick your first one. And then create a problem statement. And we've given everything in gray is kind of an idea or a thought process or suggestion of how you can create that problem statement. Next, we'll ask you to create an aim statement, and we've talked about aim statements in a previous meeting. But again, we did provide some more information on aim statements and how to consider an aim statement. So just really quickly, a good aim statement would be by December of 2022, we will increase viral load suppression on the care continuum dashboard to 78%. And it doesn't have to be the care continuum dashboard. It could be however you're tracking your viral load suppression rates or whatever project you're doing. So that's considered a good aim statement. We aim to reduce harm and improvement patient safety for all of our internal and external customers. This isn't a very good statement because it doesn't have a date that you would like to accomplish it by, and it doesn't really set out any parameters for what you would like to achieve. So in the above aim statement, we say by December of 2022, and we're also looking to meet 78%, right? So really giving yourself, setting those thresholds. What's the rationale for your project? And the infamous driver diagram. This one, it can be a little tricky and can very much intimidate people, but I think if you have an opportunity to look at the gray sections where we've kind of already built out some of those ideas for you, simply don't reinvent the wheel, just utilize those and manipulate them to fit the project that you're working on. So an aim statement, basically, you'll bring your aim statement down from above. So a lot of this is copied from above, right? And then you'll tell us, how are you going to get to this final goal or the final aim? So here again, it's by December 2022, we'll increase our viral load suppression on the care continuum dashboard by 70 to 78%. And the 3 ideas of doing that will be increased training and education. And for this particular jurisdiction, this is their health information system. So increased training and education on the E2 BP system, right? Because again, like we said there, they're having issues with service providers not entering data correctly into their health information system. So if you get bad data in, it gives you bad data back, right? The second way that they're going to look at that is decrease the number of clients with missing data components. And then the third way they'd like to do that is increase the frequency of lab results for clients. So we know people who are long-term survivors typically only go to the doctor maybe once every 9 to 12 months. In that case, in this jurisdiction, they have clients who are missing almost a measurement year worth of data because they're only going once a year, right? So they fall between 2 measurement years. And then the secondary drivers for these will be kind of more minute, so require refresher training, require new staff training, and develop a training schedule that will help them reach this goal. And some of the change ideas is work with the AEC to provide mandatory training, work with the contractor to provide E2 training, schedule time within their own agency for staff to do training, and then at the end, document the staff training, right? So this helps you create a driver diagram of how to get to your aim. Next is the actual plan, do, study, act cycle. So again, a lot of these are just copied from above, so that makes it easy on you. Just bring them down. Aim statement. What is your change idea? Pdsa should be linked to a change idea from your driver diagram. So look up here at your change ideas to see how you're going to be able to bring some of those down. Describe your plan for carrying out the Pdsa cycle. What is your prediction? What will happen when you do this, when you make this change? And then you'll tell us what did happen. And then you'll compare the results of your test and the predictions to summarize any learning. So maybe you said, you know what, doing training is going to increase your viral load suppression, but you didn't really see a correlation there. So maybe you ditched that one, but you did see a correlation between running supervisory reports on a weekly basis for missing data elements, and that increased your viral load suppression by 15%, right? So then you would use that and you could determine within your own organization if running the weekly supervisory reports and addressing those who are missing data components will be a continuous quality improvement project, right? So making sure that just becomes secondhand, everyday type of activities. And then you determine what modifications, if any, the plan needs for your next cycle. So let's say that doing the supervisor, let's say your original plan was to do supervisory reports on a monthly basis. You only saw a 5% increase. There's no need to trash the plan. That's a great increase, but what you can do is maybe you can say the time period of supervisory reports are going to be moved to bi-weekly. So now you're doing it once every 2 weeks, right? And now just redo the program again, but running those supervisory reports every 2 weeks will be your next plan, do, study, act in the next 6 months. And now you've seen a 17% increase over the last year. So just keep in mind, just little tweaks to PDSAs go a long, long way. And then finally, we'll look at data collection and how we can measure that. So you always want to, before you start your project, you always want to get a baseline. You want to know where you're starting because it'll be hard to measure and see any types of goals and gains if you don't have a baseline data. So just as an example, our baseline was 63%. We measured it in August, we're at 66. We saw a slight drop in September, but our end goal was 63 to 71%. Again, so depending on what your driver diagram listed and what some of your objectives were, you may redo the project and just increase or tweak some of the specific nuances of that project. And that is the QI worksheets. How do we feel about those? Those seem a little easy and kind of lead you through the process of doing quality improvement. Do they seem intimidating for anyone?
They always seem intimidating at first, but if you break them down into chunks, they're not.
Okay.
And
awesome.
and we found doing the fishbone diagram
Okay.
helps you get to the driver diagram easier.
There you go. Okay, that's a a great addition.
And so, and also, when we've done with agencies in the past, what they thought was their issue when they did the fishbone diagram, they're like, that's totally not what we found was our issue. So they went in a totally different direction than they thought they were going to go, because they're like, oh, this is actually what the reason why whatever A, B, or C. But then when they actually dug into it, they're like, that actually is not our issue at all. And so I think it's easy to see, and then it helps you do the driver diagram much easier. So just, and it's kind of weirdly fun. Just
right.
Breaking it down into all of the different fins or whatever you call them.
Right.
It just makes it easier to see, and it's good to get that on paper where you can actually look at things, and then it's magic.
Yep, I agree with you. And I feel like that's a fun rabbit hole to go down, because when I start doing quality improvement projects, I like to get online and get my brainstorming and tons of things flowing. And then, like you said, start with the fishbone diagram to really look at the issues and identify, and then you'll be surprised by the end. You're like, oh, that really wasn't the issue we thought it was.
And
it's
surprising because you think you know, and then you totally don't know.
Right. I agree. And that's a great point. And I feel like that kind of leads us into the next thing of has anybody here ever used Basecamp?
Is that similar to glass cubes?
Yes.
Okay.
Yes. Yep. It is. So I'm just going to show you very quickly when we get you into Basecamp, if everybody agrees that this is something they would like to do. I think Christy's idea of throwing out the fishbone diagram was like a great dialogue we could have in some of the chat logs of saying like, hey, I'm really having a hard time thinking about this driver diagram. I know when I was developing the worksheets, I went down that rabbit hole. I had to tell my colleague Derek, like, I had to step away for a day. I was like, I have done confused myself so bad. Like, I don't know what to put next. I was like, too much good energy flowing in there. You can overdo it with energy when you're doing fishbone diagrams and driver diagrams, because you start thinking of like, oh, I can change all these million things instead of focusing on a couple. So it's easy to do that. But I think it's a place for us to be able to communicate that and be like, hey, what are you doing? And again, let's steal shamelessly from each other and borrow and barter. But I'll give you a quick look into how we use this in another jurisdiction. So you'll go into the clinical quality management dashboard. Oh, I got a cough, excuse me. All right, I'm back. All right, and then so what we do here is these are all of our members of our CQM committee, including our community members, etc. And there's some messaging dashboards, and it will be, like QM committee, this one we ran yesterday, just to show, I did a refresher on how Basecamp works. If there's announcements that you just want to make across the entire TGA, like, hey, this particular place, like their hospital has now updated their visitor policy. Not part of our CQM committee, but it's some great information that you can disseminate to all of your sub-recipients within your jurisdiction. Policy clarification notice trainings. You can drop tons of information in here. And again, it allows you to dialogue and track that dialogue here. You can upload documents, you can share documents and have lots of great conversation back and forth. Then there's a section for us to share actual documents. So like I was saying here, we started using Basecamp back in 2021. And this is yesterday's meeting. Here's the video from the entire meeting. Here's all of the documents we utilized for the meeting. So if by chance you missed the meeting, or you're like, you know what, I think back in April we talked about this, you can go back or the February meeting and say, oh, that's exactly where I saw that document. It's a place for us to share. We also utilize this for when we complete our Pdsa cycles or templates or our worksheets for all of us to upload and share. Sometimes it's good to, like, I want to look at Emma's just to see where her brain went with a certain project, because I'm working on something similar. Again, not reinventing the wheel. I'll look at Emma's and be like, oh, that's where I missed a certain component, or that's where the thinking went. That looks like a good idea. We can adopt the same thing. It also allows us to have campfire. Again, this is just for casual chat. We just cut this on yesterday for casual chat, back and forth and throw ideas. You can ping people. It's like instant messaging. So if I just want to talk to Emma directly and not everybody else see it, you can do that. We also have automatic check-ins that we cut on and off on occasion. One of those is the first Tuesday of every month. It sends this out to say, what's your organization's training needs related to Ryan White service delivery, administration, and we can adapt whatever the question needs to be to help our CQM projects. And then they are also working on their second cycle of Pdsas. So their worksheets are due soon, and this is just for us to check in. Today is Thursday. So this went out today at 9 o'clock. And throughout the day, people will be responding if they have any needs about, their quality improvement projects. And then finally, it does have a place to do schedules. And so for particular this instance, we like to put things in the calendar for like, hey, your CQM plan feedback after you reviewed the plan is due. Let us know, post the comments here in Basecamp. And so we set up a specific thread for that for people to make comments. And then if you need to add that to your calendar, whether that be Google, Outlook, etc., you can click this button and it will add it to your calendar. If you get tired of hearing from Thomas, if for any reason, you're like, you know what, this thread took a wrong turn, I don't need to be involved in this one anymore. You can always unsubscribe yourself when you get to the bottom up here and say, hey, you know what, I'm subscribing. I don't need updates in this thread anymore. Doesn't remove it from your Basecamp. You can always go back and review it later. But you won't get an email notification every time I post a notice, right? And then finally, if you get confused about what's happened and you missed something, and you're like, you know what, I saw it, but I accidentally deleted the email. There's always a project activity log at the bottom of the main screen, and it will go through it. You see, I use Basecamp a lot to send out blast notifications and emails or just general announcements. And you can go through it one by one just to see what happened on particular days or times. Tuesday, see, it does a very long running log of what took place. It has some other features too that you can assign yourselves that we don't have cut on here. So I'll use another one. So this is internal for us for another project. There's a to-do thing. So if everybody wanted to-dos, we could cut on to-dos and you could give yourself reminders, etc. So there's lots of things. I would just like to open it up and invite everybody, play around with it. We'll do a little training on it next month and see if this is something that we would like to utilize. Emma.
I was just going to ask, do you know if this integrates with like Microsoft 365 and Outlook?
I believe so. Short answer, yes.
Okay. Short answer, yes. Long answer, I have to Google to figure out how to do it.
I know there are some integrations. I just don't use them, so I don't want to give you the answer of how it works. Yes, our company uses Gmail as our main provider. And I have personally had trouble in trying to integrate Google to Outlook, so I went away from that. It would create dates and start losing dates. But I know you can add certain things into Outlook, etc. Yeah.
Okay. Awesome.
Yeah. It will work with also when you get the email from Basecamp, you can respond from your email. So you don't have to log into Basecamp every single time. The only thing that you'll start noticing is if you have a very long signature line, it's going to add it to that response as well. So if you respond to a Basecamp, I'm going to try, let me see if I can find a Basecamp post real fast for you in my email. Yeah, okay, let me show real fast what it will look like. Screen 2. So if we cut the to-dos on, I was like, hey, you got to-dos that are coming up. So here's this morning's post from Basecamp about asking how is your quality improvement project worksheet coming along, right, from the other jurisdiction. And if I click here and, oh, it's going to take me there. That's a lie there. Let's see, another Basecamp. Let's see, CCP. Trying to see where somebody started responding to me yesterday. Now that I want to find one, I can't find one. Oops, I think I saw one. So for instance, like if I wanted to respond to Derek here about this harm reduction training, I can do so right from but it will also post this. So we always suggest just delete that, and that when I hit send, it automatically posts it back to Basecamp and sends Derek an email with notification. So you kind of have two, a couple of different options and looking at that and viewing, Basecamp. Either you can do it from this. It also has an app for your Android or your smartphone or your Apple phone, whatever works most convenient for you. How do we feel about this? Is this something we want to give a try? Yes, no, maybe so.
I think it would be a really good idea to have everything in a centralized place. I don't think that's something that the CQI has had in the past.
Okay.
So I'm down. As long as I can Google figure out how to integrate it with Outlook, I'm fine.
There we go. And when you say integrate, are you trying to integrate dates or?
Yeah.
No, it would definitely do
Yeah.
that. That I can guarantee you it would do. Yep. So again, like I said, you just go into let me share. Sorry. You just go into the schedule and you'll just say like, hey, oh, I see what you're saying. You're saying, will this automatically go into your schedule?
Yeah, like because I have it like with Planner, I can layer it in with my current calendar, so I can look at all my calendars at once versus having to.
So right here, there's a link that says, add this schedule to your Google Calendar, Outlook, or iCal. Yes, ma'am. There you go. Ooh, you don't have to Google now. All right. So we'll give it a shot. Again, we're going to send out that Survey Monkey to identify your SPOCs. And then we'll also confirm with who else. Everybody on my current email list will get an invite to Basecamp today. So come on in and let's see what we can do. I may reach out to some of you. I may not have full names and I'm going to need full names. Some of the email addresses do not allude to what your full name is. It may just be a couple of letters. So I may reach out to you to confirm your email address, and then we'll get you in Basecamp. And we already have it set up. Currently, it's just been, us using this directly with the recipient's office. So it will look like this. And there's already some documents in there, already some schedules, some campfires, and some message boards. And so we'll get us all in there and linked up and running. All right. Let's see. Next item. Well, I went through the quality. Oh, next one is training on the national monitoring standards. So if the meeting hasn't already been enough fun, I'm going to make it even more fun by kind of breezing through the updated to the Ryan White Program's national monitoring standards for recipients. This also includes sub-recipient responsibilities. I definitely am not going to read all 136 pages to you. We're just going to briefly skim some of the updates. So if you're familiar with the national monitoring standards in the past, all of the standards have been created kind of in a table format, right? I felt like they were really easy to read. And when I first heard they were updating these into all narrative form, I was like, oh my goodness, this is going to be so hard to understand. And I had to rescind all of the bad things I said because I feel like now the national monitoring standards are a little easier to track and follow. And so looking at just the table of contents, there's 3 components: the program monitoring standards, the fiscal monitoring standards, and a universal monitoring standards. So really quickly, we'll look at the program monitoring standards. So there's a couple of sections in program monitoring standards that are outlined. What are allowable uses of the Ryan White funds? What are some of the key components to our core medical services? What are key components to support services? There's the infamous quality management section, how to administer, prohibition of certain activities, and things of that nature. And so really quickly, we'll look at core medical services. And so when you're starting to think about updating service standards and looking at doing monitoring across all of your services, this really does outline some very key specific activities that need to be included in certain service categories. So the one in particular I'll just pick really fast, let's see, is I want to do case management because it's pretty easy to follow. So medical case management, which also includes treatment adherence. So here you'll look at performance measures and methodologies. Excuse me. All right. So looking at that, documentation of following activities are being carried out as necessary by the client. Some of those are initial assessments of service needs, development of comprehensive individualized care plans, coordination of service, implementation plan, continuous client monitoring, and periodic reevaluation. And so when you start thinking about whose responsibilities are what, when you get to the sub-recipient responsibilities, some of the things that HRSA wants to make sure are included is that written assurances are maintained to document and show medical case management services are provided by trained professionals, right? And so that's where some of the service standards gets that idea of incorporating who should be a case manager, what type of credentialing they should carry. And also then looking at maintaining client records that include required elements for compliance, right? And so these are some of the things that we'll have to look at when you do monitoring. The next section of this is, let's go back up here, is the fiscal monitoring component. Again, this outlines all of the fiscal requirements. So if you look at, like, for instance, unallowable costs, the subrecipient's responsibility in this fiscal component is to maintain a file with subrecipient agreements, assurances, and certifications, ensure that your budgets do not include unallowable costs, ensure that expenditures do not include unallowable costs, provide budgets and financial expense reports to the recipient with sufficient level of detail to track, to make sure there's no unallowable costs, and maintain appropriate expense documentation as you utilize the grant. So, it kind of explains all of that and what subrecipients' responsibilities are. And the good part about this, not that it didn't do it in the previous documentation, there's also a source citation. So if for any reason, you're unable to find the specific documentation of where this is included, you're able to go to the public health standard and look at Act 2604I. And so the next portion of that will also be the universal monitoring standards. And the universal monitoring standards include a lot of policy and procedures that each agency should have in place. If you're familiar with our monitoring process, these are all of the things that you upload to the FTP site when we ask you for, like, policies and procedures for certain things. This one includes, like, access to care, eligibility determination, payer of last resort, monitoring, reporting, and recipient accountability. So just looking at payer of last resort, the very first one is performance measure responsibilities by the subrecipient. Make sure you have a policy procedure that documents and ensures that your efforts to assist clients to vigorously pursue enrollment in healthcare insurances. So making sure they're eligible for an ACA plan or marketplace plan or Medicaid or Medicare, that they are first enrolled in there, and making sure that Ryan Wright, again, remains the payer of last resort. You're also wondering where this is located for source citation. Again, they've made the source citation very easy to track and follow. Very quick training on that. There's not much we can train you on, except for making sure that you are able to access that document. We will drop these also in Basecamp as part of today's meeting, so that if you need to go back to those. And keep in mind, there's also different parts of national monitoring standards. So there is a part for A, there's a part, and there's a national monitoring standard for B. And since you are kind of co-funded for that through multiple ways, we will make sure that you get both A and B. Also, please keep in mind, DSHS has some subsidiary policies and procedures, and maybe VVCOG also does. So you'll also, on top of the HRSA requirements, you'll also need to make sure you're following your local jurisdiction's requirements as well, right? All right, any questions about the national monitoring standards? All right, just to recap from today, so some upcoming training and technical assistance. At the August meeting, we will look at some training on the quality improvement and Pdsa cycle again. I have some really good videos that other people have already made that, I'll definitely link you to, that really do help learn the process. It's always good to look at multiple people's explanations of how to do quality improvement and how to do PDSAs, because I feel like everybody has a good workaround or a good way or methodology for doing that. Again, like Christy said today, she brought the fishbone diagram, which I didn't even think of until she mentioned it, that we kind of automatically do. If you've been doing it for a while, some little nuances that we do forget to share. So again, great way to do that. And we'll also kind of look at a high level of Basecamp. Again, I'll invite you today, please poke around, click around, do whatever you need in there, post some comments, ask for people to respond, and let's get a good hang of that. And then we'll kind of go through that next time, again, at a high level of how to utilize Basecamp. All right. And as a reminder, our next meeting is Tuesday, August the 11th. I will tell you the first thing that we'll add in Basecamp is your feedback on the plan. So please also bring your feedback to the August the 11th meeting so we can get feedback on that plan and see if there's any updates. here at the consultant and the recipient level, will also, those highlighted areas, will work on updating those sections. So if you see anything outside of those highlighted areas in the plan that you think need to be changed or addressed or updated, please let us know. Or if you have an idea of some work plan activities that we could add to it to make it more efficient and effective, please let us know that as well. And we will move forward with that. All right. That's all I have. And Jennifer, I'll turn it back over to you, ma'am.
Excuse me, Thomas.
Yes.
Hello, this is Raju.
Sorry.
Yes. I have one question for, like, on the very first page of quality improvement project worksheet. In the first page, there is project details, and below their project title. So this project title can be like for one grant for one project, or each service category can be a project title.
Yes, sir. It could be for one quality improvement project. So for our first cycle, I'm going to encourage everybody to just pick one quality improvement project. I know that we have some expert level QI people here. And, you know, if you're already doing 2 or 3 projects agency wide and you don't want to change, you know, don't fix it till it's broke. So, you know, if you want to continue with the project you're working on, by all means continue. But for those of us who are new to the quality improvement process, I'm going to suggest that you please use these worksheets. These are not mandatory. However, we would like you to be able to track, if you're not going to use the worksheets, be able to track the outcomes on your methodology. And still, please share with us what your projects are. Does that help
Thank
answer?
You. Yes,
sir.
sure.
Okay.
Wonderful. Thank
Hey,
you,
Thomas.
Thomas. Oh, go
So-
ahead.
Hi, I'm sorry, Jennifer. I just have one housekeeping item.
Yes, sir.
On at least on my calendar, I have 2 invitations with different Zoom numbers on them. Can you verify which one? I don't know if other people have 2 on theirs or not, but on their calendar.
Alrighty, yes, sir. And I think one may have been sent from Jeff, and I thought he canceled that. So that if you see one from Jeff, so I will share. So
Just
we can
cancel that
see.
one. Okay.
Yep. So here you will see it should end in 00002. So if you have that update,
thank you for that.
You're welcome. Yes, sir. And I will always send out that kind of reminder notice with the correct. And then once we start using Basecamp, it's going to remind you as well. So you'll be able to get the correct newly updated and kind of remove those from your schedule. Thank you, Ken. That's a great call.
In the
Thank you for
chat,
catching me.
Justin says he has 3 invitations.
Justin special. No, I'm playing. Justin, I'm not sure. So what we may want to do then is, yeah, let's do this. If everybody wants to delete all of the meetings out of their schedule, and I'll resend the calendar invite today. And that way it will kind of update everybody's calendar. Does that work? Okay, so yeah, delete them out today, and then I will resend the updated CQM activity, so that way we can clear all the extra calendar invites out.
Okay, thank you, Thomas. Thank you for all of the wonderful information that you provided, and it looks like we all have a lot of tools that we could utilize when it comes to our plans. We're going to move on now, and I'm going to pass it over to Michael, and he's going to go over national monitoring standards. Michael, you have the floor.
I stole Michael's thunder and I already went through. I'm sorry.
I was like, hold on, wait, we just did that.
Oh, we did.
Yes,
Oh,
ma'am. Yep. No, it's not 2 separate ones. We were going to do A and B, but
got it. Got it. Okay, wonderful, wonderful. So I guess that brings us to the end of our meeting today. Does anyone have any follow-up questions or any comments at this point in time? Okay, well, thank you everyone for coming and attending. And I will be reaching out via email so that we could work on getting the SurveyMonkey survey out to you so that we could get your contact person. And I look forward to speaking with everyone soon. Thank you so much.
Great. Thanks, everyone. Have a great weekend. All right.